Hello, welcome to Glendale Today. I'm Councilmember Sam Chavira, and I represent residents living in the Yucca district, located in the southwestern part of Glendale. Since this is my first Glendale Today, I'd like to take a moment to introduce myself. I was elected to represent Glendale's Yucca district in November and began my term January 15, 2013. I serve on Glendale's Government Services Committee, the Maricopa Association of Governments Regional Domestic Violence Council, the National League of Cities Public Safety and Crime Prevention Committee, committed to making the community a better place. I've served as a firefighter in Phoenix for 14 years, was a founding member of the Cesar Chavez Foundation, have lived in Glendale's Yucca district for the past 2 decades with my wife, Judy, and 2 daughters who attend Desert Mirage Elementary School. The Yucca district will soon be home to an exciting new hospital. On January 30th, Dignity Health broke ground on St. Joseph's Westgate Medical Center, which is currently under construction near the Loop 101 and Glendale Avenue. Here to talk about this project is my guest, Gregg Davis, who is the Chief Strategy Officer of Dignity Health. Welcome, Gregg.
It's a pleasure to be here, Councilman.
Can you describe this new hospital for us and what it will mean for the future of Glendale?
Sure. This hospital is called St. Joseph's Westgate Medical Center. It is the 4th hospital that Dignity Health Arizona will have in the Phoenix area. It is our first hospital that we will be building in the West Valley. We currently have several resources here in the West Valley, including primary care facilities, specialty clinics, as well as imaging centers and surgery centers, but one of the things that we do not have out here to represent Dignity is an acute care hospital. And so this is really our first step out into the West Valley to establish an acute care hospital presence for Dignity Health here and at this facility.
Residents of Glendale and the West Valley will now have better access to St. Joseph's premier specialists. Is that right?
That is correct.
Gregg, you'll soon be an important member of this community. Tell us a little about yourself and your career. How did you get into this business?
Sure. I've been a hospital and healthcare administrator for around 25 years. Since I graduated college with a bachelor's as well as a master's and entered into healthcare immediately after college, and have consistently worked my way up through the system, starting off as a director of a facility and then progressing up to more senior positions. Currently have been out here with Dignity Health for about 3 years. Was previously the Chief Operating Officer for St. Joseph's Hospital Medical Center, and have been acting as the Chief Strategy Officer for the Dignity Health Arizona market for the past year.
So certainly when it comes to St. Joseph's, you're very well-rounded in what they have to deliver.
Sure. St. Joseph's Hospital Medical Center is probably one of the more complex hospitals in the country. We do have outstanding specialists as well as some of the premier services, not only in Arizona, but really in the Southwest. So St. Joseph's is home to the Barrow Neurological Institute. So we're very proud of that, and the physicians and staff that work there, as well as the resources and services that they provide not only to this community, but both nationally as well as internationally. We also have quite a few other specialties that are very specific to St. Joseph's, and again are what I would say very high caliber specialists. So we're the home to the Heart and Lung Institute. Our thoracic surgeons are some of the top in the country. And we also have other specialties that we're able to provide high-end services for this community.
You know, Gregg, having many relatives and many friends that have actually utilized the services at St. Joe's, I have a great affinity toward the hospital. So
Sure.
When it came to our city, and especially my district, I was very, very pleased and excited. You've worked in hospitals for a lot of years. What is the average day like for you? Are you in the clinical areas or are you behind the scenes?
It varies, and it's hard to say that there is an average day, but it is a very busy day. But some of our duties, I would say there is some consistency. We focus quite a bit on our relationships with our patients, as well as our staff members and our physicians. So a typical day would have us spending time with physicians trying to identify opportunities that we might be able to work on together to improve care or enhance access to care, or to address some of the issues that might be happening within the facility. We spend time rounding on the floor A lot of times it helps us understand by talking to either patients or their families, or talking to some of our frontline staff, such as the nurses and the technicians and technologists, really the caregivers, to better understand what is really happening out on our floors. It gives us an ability to appreciate what they're doing, some of the challenges that they're faced with, and hopefully come up with some solutions to allow us to provide better care. Here recently, we're spending a lot of time with outside entities such as insurance carriers, political figures, trying to understand healthcare reform and the changes that may be coming forward. And like myself, many times we have construction projects that are going on, and so we're outside the hospital trying to understand again how we can keep moving those opportunities forward.
So you would agree that communication is key to maintain that balance of service?
Absolutely, and that's one of the things we really try to focus on. No matter how good of a job we're doing as healthcare executives, improving our communication, whether it's communication with our patients and family members, communication with our frontline staff, and communication with our physicians is key.